Well, why don't we talk a little bit about Businessolver? I was joking as we got on the call that I just got the e-news, Businessolver e-news come through this morning. So that was really well timed. Can you talk a little bit about what you're seeing? I mean, you've got, coverage across all industries or across all different kinds of clients. You've got all sorts of different benefit services and administration going on. What are you seeing across all of the Businessolver universe that you think might be interesting for pools to know?
Yeah, so, I think what we've been seeing specific to COVID is, initially, I think a lot of employers were looking at this with a really optimistic lens. And so we saw a lot more furloughs than we did actual terminations. And you can see that in our data. And now over time, because it hasn't rebounded as quickly as most had hoped initially, we're starting to see those furloughs turn into terminations. And so one of the things that we've been working really diligently on with our clients is how to create that softest landing place for an employee. Because what it's really highlighted, not that we didn't all know this anyway, but what this situation has really highlighted is that dependency on health insurance with the employer. And when you lose your employment and you lose your health insurance, particularly in the midst of a pandemic, the last thing that you want to do is go without health insurance. And so that tie between the two has really been highlighted, which is why in that article that was just released today, I think it'll be really interesting to see. We already had clients that were looking at how do you leverage the new individual coverage HRA rules to be able to provide people with money and then let them go shop for their own individual coverage. But that way that coverage can stay with them through any sort of up and down, and it's no longer tied to the employer. So I think that's what'll be interesting, because that's what the, again, with all the furloughs and then leading to terminations, what it's really highlighted is that dependency. And again, in a pandemic, that's about the worst position you could be in, is you've now lost employment and you've lost your health insurance.
So you were sort of seeing that trend before, right? The individual coverage HRA trend, and now you see it maybe elevated or highlighted a little bit. Like, what do you think that looks like? Is that a 3-year transition? Is it a 10-year transition? Do you think that's the direction we're going to end up?
I had always said from the time it was passed, it would take about a decade. So I liken it to, you can look at a couple of different scenarios in the benefits world. So when you look at when the 401k regulations were first passed, and was that it would supplement pension plans. But over time, 401ks really ended up replacing pension plans in a lot of situations. And then you can look at the same thing with retiree medical. A lot of organizations that offered retiree medical from a group basis converted that over to provide a defined contribution and allow that retiree to shop for individual Medicare coverage. And in each of those trends, every time one of those trends happens, it moves through the system at a more rapid pace than the trend before it. So I had said about a decade for sort of more massive adoption. I don't know. I think it could happen faster. What's interesting, last summer when we started to launch a solution to be able to support the individual coverage HRA strategy, but last summer where we thought it would get most highly adopted the fastest was for a part-time benefit ineligible population, because we had such a tight labor market, strong economy, and our clients were having a hard time capturing that part-time workforce and having some sort of stability in that part-time workforce. So we really thought using the individual coverage HRA to give us a stipend, so what would have been a benefit ineligible population, would really be a benefit for attraction and retention of a part-time workforce. Now, fast forward, the world has changed dramatically, and now it's more of a, how do you mitigate the risk on the group plan? How do you provide protection so somebody can keep the insurance plan that they have at the same cost post-employment? So the sort of the why of why employers are looking at it has changed dramatically in the last 6 months. But I honestly think it'll speed the sort of the adoption of the individual coverage HRA methodology.
Yeah, that's a really interesting sort of side result or secondary result that maybe we're not thinking enough about how that impact might pull through.
Right.
what about public entity pools specifically in the work that they're doing with public entities? Do you see any sort of acceleration or changes or things that are happening different in that public entity space than in your other clients?
Yeah, I think what's interesting too, when you look at, again, specifics at COVID and what's been happening just from a claims perspective, you've got two primary impacts to claims. One is an increase in claims for COVID testing complications as a result of COVID. But actually the bigger bucket of claims that it looks like will have an impact on the plans is the deferral of services. I oftentimes use my mom as an example. So my mom was scheduled to get hip replacement surgery in March, and she obviously didn't have it. And working with her provider, they're saying it'll be 12 to 18 months before they can get her scheduled back in. And so now she's like, well, where do I go? Can I go somewhere else sooner? She's in a tremendous amount of pain, right? She was sort of emotionally prepared for the surgery as well. And but so that's, when we look at our employer base, where they've got employees sort of scattered across the country, it's harder to help support that type of rescheduling of services. But for the public entities where most of their employees are in a centrally located from a geographical perspective, that's where we see the public entities starting to really step in and say, how do we help get cost and quality information in the hands of our participants and really better handhold them through this rescheduling process, which does two things. A, from just an empathetic perspective, to be able to support those employees. Obviously, that's super helpful to them. The other thing, from a plan cost perspective, most of those deferred services will probably start coming through more so in 2021 as providers start to work those individuals back in. And so, when you're trying to do claims projections for 2021 plan years and how will that impact, the more of those services that you can ensure get into not just in-network facilities or providers, but high quality, lower cost providers that are also in network, you could have a pretty significant impact on your overall claims expenditure too.
Yeah, so that's pretty interesting because that's a real sort of value add that many of the pools provide their public entity members, right, is the assistance with that administrative edge. And so one question that we've heard is the pools are, trying to project and look at when that, I guess, deferred care bubble, right, comes back. When does it really, is it 6 months? Is it 12 months? When does that same volume of claims and cost of claims come back? And what you're describing suggests maybe that the pools are going to see that bubble hit sooner than across the industry as a whole, because they're going to be helping with rescheduling. They're going to be helping with making sure their members get that care more quickly in the deferral timeframe. Is that fair?
Well, and part of it's about speed. The other part, though, is about really directing care to high quality, lower cost facilities. Because what you don't want to have happen is have somebody like my mom who had deferred care and now she's sort of anxious to get it. You don't want to have her reschedule at a lower quality, higher cost facility, or even worse, at an out of network facility that costs everybody more money in the process. So I think it's partially about the speed and supporting participants to get those rescheduled more timely, but I think it's also a lot about the cost and the quality of care.
Yeah, that's a really, really great consideration. Thank you. What about Businessolver itself? You're seeing, again, all of these issues and trends, whether it's the introduction of the individual coverage, whether it's that deferred care bubble and, when your mom is going to get her surgery or whatever it is. So as you're looking at that entire spectrum, what kinds of services are you seeing most needed? What kinds of things are you doing differently with an eye towards, helping those clients do what they need?
Yeah. So I'll be honest, I think I've heard the word pivot more times in the last, 4 months, 3 months than I've heard my entire career as it relates to our product roadmap. We've always considered ourselves to be really agile from a technology perspective, but this has tested our limits, I'll say that. But we're really trying to ensure that we're getting a lot of different things, right? Making sure that we get the right data into organizations' hands to help them plan. getting the right support to the members so that they know what actions to take, and then actually creating new solutions to help with that softer landing for those who might be displaced from an employment perspective. So if we break those down on the data side, we launched, if you go to businessolver.com/pulse, but what it is where we're tracking across our clients what the whole client-based impact is, so that you can see the trends on, and sadly it's a lot of active employment going down across our client base, furloughs or leave of absence going up. And then I think what we'll start to see, unfortunately, is what we were talking about, where the furloughs will start to transition to terminations. But we're tracking all that data in aggregate just to help clients continue to keep a pulse on what's happening within their industry, what's happening, across the country. It's got data in there about what's happening from a geography perspective at a really detailed level. So it's helpful to see, within your community, do you tend to be in a community that's being hit harder than others? So there's a lot of really good data that employers can leverage just to help them think through from a business planning perspective what might be happening in their community or what are within their segment. So that's on the data side. From a participant perspective, we've seen some really interesting statistics. So we have Sophia is our artificial intelligent virtual assistant. We've always had pretty good use of Sophia anyway, but from this time last year to now, we've seen a 62% increase in Sophia chats. So people are definitely looking for information real time. They're getting more comfortable with that technology. She answers a lot of questions about COVID, what symptoms to look for. She's pulling data from CDC to be able to help support those conversations with members. We're also seeing night and weekend chats have gone up 223%. So I would have thought, honestly, I would have completely misprojected this. I'm an actuary by background, and so this one really threw me off. I had figured that with more people working remotely, that the requirement to have those conversations at night and weekends would actually go down because you could multitask better. You're not in the office, you're sitting at home. But that hasn't come to fruition at all. A lot of the increase has been in the night and weekend chats. The other thing that really changed is logins from a mobile device. So a lot of people who were using their laptop. So we saw logins from a mobile device into our system go up 217%. So it really shows people are using their handheld device a lot more from a interaction perspective regarding their benefits and their care. So I think that's been really interesting. So part of what we've really been doing is a lot of uptraining of Sophia to be able to support a broader set of questions around care, conditions, COVID, et cetera. So one of the things that we're working on right now, as it relates to the conversation that we just had about helping people find quality of care, is embedding a tool within our system that can actually help people get there faster as well. So we're looking at that as a future product enhancement. And then that third category from helping people who have been transitioned out of their employer-sponsored plan. COBRA's super expensive. COBRA's only available for 18 months. It might not be the best plan for you. COBRA requires that your family is all in the same plan. If I look at myself and my husband, our health circumstances are totally different. But in the employer-sponsored world, we end up in the same plan because that's how the plans work. In the individual market, you can actually customize your plan based upon your family members. So I can be in a different plan than my husband, which is a benefit. So we had already launched, we call it My Choice Market. We had already launched My Choice Market to be able to support off-boarded populations from our employers. We've seen a massive uptake of people leveraging My Choice Market because they're not terminating from one job to go to another job. They're, getting terminated in the midst of an economic downturn. So we're seeing, in the first 10 days of May, we saw more people participate in My Choice Market than we saw in any whole month ever in the past. So there's definitely an uptick in that. One of the things is we started to look at the data, not just for our own clients that I mentioned that we're tracking, but when you look at what's happening just globally with layoffs and terminations and the impact on people, we felt really passionate about being able to help people, not just within our client base. So we actually, as of earlier this week, just 2 days ago on Tuesday, it's been a long week, but we took My Choice Market direct to consumer too. So it's our first, for Businessolver as an organization, it's our first foray into a direct to consumer environment. We didn't launch it broadly. There's no big marketing campaign or commercials or anything like that. We're really just leveraging social network channels. We've had, even I helped my neighbor the other day, a lot of people are impacted. And so it was good for us to be able to do that, be able to offer these services more broadly. And we're already seeing significant uptake just through social channels from our own Businessolver employees, letting people know that this exists to help them. So that was a mouthful, right? But we've done a lot. If I look a little tired, that's why I think, I had expected I'd have all this free time now that I was at home, and I've been working more than I ever have, I think. But it's all with good conscience to be able to help people through these tough times.
Yeah, it's so intriguing to hear the issues that you're raising and the conversations that you're having, the solutions that you're bringing. Like I'm hearing it in two really different layers, right? One is sort of the COVID related response and needs. And so you're talking about the claims and the deferment of care and even like COBRA and continuation of benefits and how it looks different right now because of the furloughs and terminations that are happening. But then you've got this whole other element that you've done a great job of raising that is about, what is it that's happening now in this COVID-19 response that's going to accelerate or elevate or change things that were happening anyway, but just aren't going to go back, right? So the individual care
Right.
certainly is one of those. Your description of Sophia and the tech reliance, when we've heard that in telehealth too, that the utilization of telehealth
Right.
now is so different. So this is the catalyst for getting people used to those things. Do you think it'll ever go back to what it was, or is this just the new norm?
I don't.
Yeah.
I think this will be the new norm. I think it was the impetus to get people to use these tools and then be like, I think telehealth is a great example, right? It's one of those places where people go, I have to see my doctor. He has to physically see me. And, now they didn't have that opportunity. They use telemedicine. I've had friends say, because they'll call me, everybody calls me for advice. They're like, what do I do? I can't go to my doctor. I'm like, check with your employer, see if you have telemedicine. I'm like, I did, and I used it. It was great. I'm never going to go back to the doctor's office. So yeah, I think it's really going to change how we interact, both from a health perspective and just an overall engagement perspective going forward.
Cool. So cool. Sherri, is there anything else that we haven't talked about or that you think would be useful to share with pools?
Probably the only other thing that I want to point out, because this was, even just think about this brief time we had together and all the complexity of what we talked through regarding care and rescheduling services and ICRAs, and right, there's so much happening, and the pace of that change and the impact to the individual is so significant. What I can't stress enough is to communicate. I'm sure you already know that. But the more that you can help people, the more that you can help them understand what they're facing, what options are available to them, what tools and resources are available to them. That's the one thing I can't stress enough is communicate, communicate, communicate. People are so confused, and they're dealing with, like I am here at home. I have an 8-year-old that was sent home from school. So I'm now balancing work and being homeschool parent and all sorts of things, right, that we've never had to balance before. And so the more that you can help people understand those resources available to them and communicate to them, the better off everybody will be.
Yeah, that's a good reminder. So 8 must be about 3rd grade-ish?
Yes. Yeah.
Right. So that's a really hard math year. Your actuarial background probably comes in handy.
I'm loving it. So it's funny because I talked to his teacher the other day and I'm like, so I just couldn't stand it. I started him on algebra. And she's like, you did what?
Oh man.
My husband's doing all the social studies and that type of work, and I'm like, I've taken over the math, and I think I've got him accelerated in math now. I quite enjoyed it, to be honest.
Oh, super fun. That's some time that it's a good reframing of an otherwise difficult situation, right?
Yeah.
Well, thank you again so much for taking the time today. Really great information, and we just appreciate that you're willing to share.
Yeah, thank you for including us. We appreciate it.